in drug discovery and therapeutics. I take immense honor to introduce today's speaker, Dr. Sonal Shekhar Sir, currently working as Associate Professor in Department of Pharmacy Practice, Manipal College of Pharmaceutical Sciences, Manipal, India. Sir has completed his B.Pharm in JSS College of Pharmacy, Mysore, and M.Pharm from VIPS, Bangalore. He has completed PhD from Manipal Academy of Higher Education, and he already has more than 17 years of experience in clinical pharmacy, teaching, and research. Sir's area of research interest focuses on drug safety, public health pharmacy, pharmacoepidemiological research, and etc. Sir has 76 publications in national and international journals to his credit, including journals like BMJ Global Health, and also written 14 book chapters in nutrition and clinical toxicology. He has also received Pharma Bridge Fellowship from FIP Netherlands. Sir has established public health pharmacy under Manipal Academy of Higher Education. Sir has visited various countries like Japan, Malaysia, UAE, Australia, Canada, Thailand, Italy, Netherlands. Sir has also received Shastri Indo-Canadian Institute grant in 2022. Sir has been cherished with many awards like Appreciation Award for conducting community outreach program. Sir has been awarded the Best Poster in Manipal Cardiology Update 2016 and 2018, Falcon in 2016, and Publon Receiver Awards. So with a warm greeting, I would now like to welcome our eminent speaker, Dr. Sonal Shekhar Sir, to start the session.
Thank you, Kirti, for a nice introduction. Am I audible now? Hello?
Yes, sir. Yes, you're
audible. You can see the slide, no?
Yes, sir. We can see the slide.
Yeah. Thank you for VRR College for giving this opportunity. So today's my talk is actually on opportunities and challenges in the pharmacy practice research. So majority of these participants are students or faculty?
They are faculty, sir. Most of them are faculty.
Faculty, okay. So this is a very basic slide I have prepared. So I thought that mainly students will be participating. But still, most of the things I am presenting is actually my past experience on the research in the field of pharmacy practice. So anyone have any doubt, even in between also, you can stop me and ask. So I know that this is a virtual presentation. Still, there we can do an online interaction if you are willing to do in between. So already I mentioned that the topic, this is nothing but what are the opportunities and challenges in pharmacy practice research. So coming 45 to 1 hour, I am going to cover the following topics. You can see that what is research. When I'm talking about the research, it's mainly related to pharmacy practice research. Then what do you want to do? Why you want to do the research in the field of pharmacy practice or any other field? Then what are the different types of research? When you see the type of research, there are various classification of the research. But what I'm focusing here is mainly on the outcome-based research. Then we can see how to develop a research question and how to conduct a research, and after the research, how to disseminate your research findings, and even after the completion of the research, what is after, what we can do after the research with your findings, and even what are the challenges during the time and even after the research. That things I am going to cover within another 45 to 1 hour. So I want to start my presentation with a very famous quote by Wernher von Braun. He is actually a German-American aerospace engineer. So he have said that the research is what I am doing when I don't know what I am doing. So this is very self-explanatory. So why you want to do the research? To find out the solution for anything. So in this particular area, you want to find out some new information or even new solution. So we have to do the research. So this is actually very fundamental aspects of doing the research. So you can see the classical definition, the Cambridge dictionary. If you go and see the research meaning, a detailed study of subject, any area of subject. Even pharmacy itself, we have the very different area of research. So especially in order to discover new information or research reach a new understanding. Okay, all this simple way we can call the research. So already I have told you that why there are different kind of research we have. So whenever we want to start a research, first thing you should know, why do you want to do a research? Okay, when you are talking the idea or purpose of doing the research is based upon the person to person, it will vary. Okay, you can see that if in the student's context, the purpose is totally different. Okay, we can say that partial fulfillment of their what are the course, the program they are doing. For example, Farm D. Okay, Farm D, they have the 5th year, they have to do the research. There is a 6-month research component in their syllabus. Similarly, M-Farm, okay, that fourth sem, third sem, and fourth sem, they have to conduct the research. So that's what the purpose is different. The student purpose is totally different from the faculty. Faculty is why they are doing the research, either for the promotion or career advancement. Okay, that's the reason we are doing research. Sometimes it will be conventional way. Sometimes you can see that the people doing the research because of their passion. Whatever the way we have to do the research, if you are in the field of education or in the field of industry, or even obviously if you are in the research field, obviously you have to do the research. There is no other option. Okay, why I want to stress on this slide? Okay, because what are the prospective students, those who are looking, Farm D students or even the M-Farm students, any area of M-Farm, if they want to go for the abroad for the higher studies, or if they want to go for the job purpose, one of the thing everybody is looking to your CV. So the CV means you can see that how you have contributed for the research or education or even the policy making. That is very important. If you see in India, you can see that most of the time the subjective, when you go for interview, you can see that how we are actually impressing the interviewer. So that depends upon the subjective data most of the time. But when you are applying for some foreign universities, especially this is for the students I'm talking. So you can see that after Farm D or M-Farm, if you are applying for higher studies like PhD, or if you want to join some courses in abroad, so they will see that what is your expertise. Okay, they will not believe your subjective that what you are orally talking or what you are written just in the CV. They need clear evidence. Okay, how the clear evidence you will put in front of them. Okay, what are the research you have done, and if you have published that one, so they will believe. That is called some kind of objective data you have to show. So most of the time, the faculties will find it very difficult when students are approaching us you can see that after the completion, student want to get some letter of recommendation when they are applying for the various universities. So if you didn't do the proper research and publish, so it is very difficult us to write a letter of recommendation. We can give the general recommendation, but that does not have carrying any value. So if you have done research, publish in a very good journal, and if you have done some funding, if you have received while doing the research, all this will be some kind of objective data. If you are written your CV with supporting evidence, so anyone can. Now it's almost the journals, everything is an online journal, right? It is print versions are actually disappearing gradually, but most of every journal is now available. Around 99% of journals are in the online. So anyone can access and verify your details, whether you have really done the research or not. So when we are applying for foreign universities, they will see if any supervisor or anyone you have contacted, you have to see that your area of interest is matching with their area of interest. Similar way, they will also cross-check whether this guy has sincerely done on this particular area, what he has written in his CV is correct or not. So that should be reflected through the online or publication. So that's what very important when you are doing the research. It is very, very important to publish also. That's what we will see how the coming slides, how to disseminate your result data, everything. So next we will see that what are the different types of research. So there are different kind of definition for the types of research. You can see that based upon the study design. Okay, if you clinical studies, you can see that the cohort study, you can see a similar way, you can see that randomized controlled studies, cross-section studies, similar way, you can see case control studies. These are based upon the study design we can classify. And the classification is based upon the implementation. research or operational kind of research. So there are different type of research, but what I want to focus is actually outcome. Based upon the outcome of your research, how you can actually classify. So mainly we can say that most of these researchers are actually like novelty kind of or utility kind of research. So novelty kind of research, you can see that if you find out a new drug or new formulation or something novel kind of, you are coming out with a novel thing. So that is called the novelty kind of research, new thing. But utility research is actually, for example, you can see quality improvement research. You want to improve the quality of some clinical pharmacy services. Okay, drug information services quality you want to improve. For that, you have to do some kind of research, right? Similar way, if you want to do a quality improvement of pharmaceutical care aspects. Okay, so for that also, you have to do, that is actually, that kind of research are actually called utility kind of research. Most of these our pharmacy practice research are coming under the utility. Okay, so most of the time it may not be novel, but there will be exceptions. Sometimes it will be novel. Clinical research, clinical trials are actually novelty kind of research. But you can see that most of the academic research, PharmD students or MPharm students, what they are performing. Okay, most of the time it will be utility kind of research. For example, you can see the development of antibiogram for the hospital. Cannot, it is an ongoing process. Once you are, right, the antibiogram, it is a cumulative antimicrobial susceptibility pattern, or cumulative, other way around, if you say cumulative antimicrobial sensitivity or resistant pattern. So that actually, most of these hospitals, they will prepare their own antibiogram. So some hospital, for example, our Kasturba hospital, they will update this antibiogram every 6 months. So for that, they need to do some kind of research. They have to collect last 6 months, what are the resistant pattern of particular organism against the various antibiotic kits. Okay, so based upon that, they will develop the what we can say antibiogram. So this is some kind of utility kind of research. It may not be a novel, but it's a utility kind of research. So that's what I'm emphasizing again, that most of our pharmacy practice researchers are actually utility, direct application you can see in the clinical settings. So it may not be novel, but as I mentioned earlier, new drug discovery or even the new formulation, all these are coming under the novelty kind of research. Now we'll see, you can see that when we are, how we'll start a research. Okay, this is something most of the time the students will find difficulty when they are coming, when they are allotted that guide or even searching for the topic. So this slide actually what I have put that usually my experience, how I will actually select the topic or what we can say motivate the students actually to do their research. So how to develop a research question. This slide is mainly I want to focus on for the students purpose. You can see that there are different people are adapting or doing the different way of developing their research question. But what I will usually do is actually there are different methods in that, mainly the literature search or through the clinical experience. So I will present with a few classical examples what we have done. What we had done for the literature research examples coming slide, you can see similar way some of the topic we have set or research question we have derived through the clinical experience. So first thing you can see, whenever any students, okay, normally our college MPharms, so we will allot the students, PharmD and MPharm students, based upon actually we'll give the preference to the students. For example, you can see that 5th year PharmD have the project work. So we have around 11 faculty we have in our department, pharmacy practice department. So we are not directly selecting the students. So we will put the students one class test, like you can see that pharmacotherapy and research methodology, some multiple choice questions, class test we will conduct at the 4th year itself. Almost like near to the end of 4th year, we will conduct a test. So by the time they may be studied pharmacotherapy, everything. So we'll do a class test. Then based upon that, we will rank the students. Okay, meanwhile, each faculty's research areas we will display. So the rank 1 student will get the first preference to choose according to his interest to the faculty. Similar way, rank 2 person can the student will choose. Okay, that way they will choose the faculty, and when the students are allotted to the particular faculty, they will approach to the students. Guide. So when any students approach to me with the for doing the thesis, research. So what I will do, either I will tell that the literature, you have to do a literature search. Literature search means you have to go and read the recent journals, like recent articles in a reputed journal. Like for example, you can see here BMJ or even the Lancet. So these are some of the top journals in that will publish the clinical studies and even preclinical studies also. So it will tell you, if you do the literature search in the good journal, it will tell you what is actually the current focus of research. Okay, what are the preferences and what are the ongoing the current area of interest to our research community. So I will tell them to students to go through these journals, even the other like the New England Journal of Medicine, and so they will get an idea that okay, what is going around the world in the area of research. Then if any kind of any catchy or anything topic, if they are finding across, so I will tell them to list out the students. Since PharmD this research is actually group project, so there will be multiple people. I will tell each people to look into the various topics and find out and list out the topic after you are reading that topic. That is the one way we can develop. I will come to that again later to give some classical example how we have developed the research question by the literature search. Next method, what we are will do, like you can see already I mentioned that fourth year itself students will be allotted to the guide, end of the fourth year almost. So already the PharmD students in the fourth year PharmD or first year MPharm students, they will be already in the exposed to the clinical setting. So they may be when they are, in our cases fourth year PharmD, they will be going for the ward posting. They will be posted in the ward in the morning, and afternoon they have the theory classes. So when they are in the ward, seeing the various cases, they'll, if they are interested in particular cases, so they can think about developing the protocol from that cases. For example, so a few years before in our hospital, a lot of you can see alcoholic liver diseases cases here. So we students came and told me that there are a lot of alcoholic liver diseases cases. So why we can't study about that? So because that is very feasible, because we are going to get a lot of patients. Okay, so that is a clinical experience based developing the research protocols. Sometimes even you can see that if you have very good rapport with the doctors in your hospital, sometimes doctors will come and tell that, okay, I have seen, I am interested in the various this area of interest. Okay, so why can't we do a research? So for example, we have last few years before our one of the clinician infectious disease doctor came in to approach me and told that we have cefepime induced neurotoxicity. They have seen a lot of cases of cefepime induced neurotoxicity. So that is based upon their clinical experience. So we thought that why can't we do that study on the, so that also coming slide I will show you the how we have conducted and how we have published that article. So these are the two methods I will follow. Okay, for when students are approaching directly, we will not give any topic, because idea of this research or thesis or dissertation in their syllabus is to develop a critical thinking, how to develop the protocol, how to critically think and reach to the research question. Okay, so that should be step by step. They have to develop that what skill. So that's the reason we will not directly give to the any topic to the students, especially MPharm and PharmD students, so even undergraduate BPharm students. Now we can see that BPharm also have the project in their PCA syllabus. So we'll tell them to, we'll try to sharpen their skill. Like you can see that how to develop a research question, how to develop a hypothesis from that, and finally what title they have to write, how to develop a title. That also some kind of research, some kind of skill is required to write the title of the topic also. So that's what, these are the major two methods what we are following for developing the research question, finally hypothesis and title protocol. So, anyone have any kind of query, you can ask me. I'll just wait for 30 seconds. If you have any questions so far what we have discussed, you can ask me. So otherwise, I will move to the next question, next slide. Anyone have any doubt?
I think you can continue.
Yeah, okay.
Yeah.
Yeah, okay. Yeah. Okay. So I have already mentioned about the literature search. That is one of the methods we will follow to derive the research question. So this is one of the classical example what we have done actually. This study, the current slide we are not done, study we are not done, but I will show you how we have done the literature search and reached to the topic research question. So you can see that 2014 there was one pathbreaking publication. We have seen the Science Translational Medicine. So they have published one article that metformin as adjunct therapy for the tuberculosis management. So title itself you can see metformin as adjunct anti-tuberculosis therapy. So what they have done, this study they have given the metformin and seen for the TB patient and seen that the intracellular mycobacterium growth, it is inhibited by the metformin. So already the mechanism what they have told that normally TB, you know that will give the complex regimen, isoniazid method, you can see that isoniazid, ethambutol, rifampicin, okay, streptomycin, all these combinations. This is a very complex regimen. Okay, the current therapy, what they are telling justification for finding out the new therapy, they are saying that current therapy, you can see that it is pathogen targeted because all these anti-TB medications are antimicrobial drugs. Okay, so that will target the pathogen. But the problem with current therapy is combination, the regimen is very complex. Then you can see that each individual classes of this medication have a lot of adverse effect. And apart from that, including the liver failure, you can see. Apart from that, you can see there is a high chance to develop the resistance. So what this study, what they proposed that, along with this, the traditional, you can say traditional anti-TB medication, if you give the metformin, so metformin is actually host-targeted therapy. There, host-targeted, already you know that metformin is actually AMPK activator. So AMPK activator, it will increase the immunity of the host, the people who are getting affected the TB. So that people's host immunity, the metformin will increase. So thereby it will culminate the growth of tuberculosis bacteria, mycobacterium tuberculosis. That's the mechanism they have proposed, and even they have seen that some of the effect in the preclinical studies as well as even the clinical studies, they have shown the effect. So we have thoroughly read this article, metformin as adjunct to anti-tuberculosis therapy. So then we thought that, okay, if metformin has shown the therapy effect, already they have told that it will increase the immunity. It is a host targeted rather than the pathogen targeted. So it will boost the immunity through the AMPK activation. So we thought that why can't metformin can be used as a protective, instead of therapy, treatment, those who are getting the TB patients giving and curing the TB. Why other way around we can think, like you can see the metformin have the protective effect, whether metformin have any kind of protective effect against the TB. Okay, we try to look into the protective effect against the TB. But the challenges here is when you are looking for the protective effect, we cannot give any person metformin unless he does not have the diabetes. Okay, the doctors will not prescribe the metformin for the preventive purpose. It's not a standard of therapy, right? We are just going to study. So we have to this is actually we are going to. I plan for the PharmD project, so we can give only observational study. We cannot go for any kind of interventional study at that level. So doctors will not write the intervention for the metformin for the prevention of TB. There is no clear-cut evidence. Just at that time, it was only one study I have published in the 2014, as I mentioned. It can have some kind of anti-TB effect. So we thought that we need the the patient should have the TB with the diabetes. Okay, so diabetes, obviously, patient is already on the metformin. So when we have thoroughly dig into the literature, we have seen that it's very well established now. You can see that the TB diabetes is one of the risk factor for developing the TB. So you can see International Diabetic Federation data, okay, IDF data. So itself it is saying that around 15 to 30% of diabetes people have the risk of developing the tuberculosis. Okay, 15 to 30% of people have the higher risk of with the diabetes have the risk of developing the TB. So diabetes is almost like 3 times. Diabetes people have the 3 times of getting the tuberculosis, the risk. So that's what the literature is saying. So then we got an idea. Okay, why we can't recruit the people who have actually the diabetes. Okay, so diabetes and see whether they are getting the TB. Okay, so we had diabetes patients have be most of them will be in the metformin. Sometimes will be some people, very few people maybe non-metformin will be there. But here challenges is that we cannot say that when TB is going to get, right. So this prospective studies is not at all feasible because the outcome we cannot say that PharmD project is only just 1 year project. Okay, 1 year means most of the time it will be 6 months. We will get the time. So we cannot go for the prospective study because the you can see outcome occurrence, it will take time. So what we have done, it is a retrospective cohort study we have planned. A retrospective cohort study. So we have what are the patients, for example, we have conducted this study in 2015. So we have recruited the patient who are admitted in the hospital in the 2010. And we have retrospectively followed them. Okay, we made 2 groups. One is actually metformin with combination. Okay, diabetes patient, those are on the metformin and this combination. Another group is non-metformin. Okay, for example, insulin or other group. Okay, usually getting the non-metformin group is very difficult among the diabetes people. Most of them are actually, you can see that they will be in the metformin. But still we will get few people. So some of them are insulin, some of them are actually not metformin, some other drug. Okay, but metformin and its combination. In the combination also metformin is there. We have taken as a study group. Okay, other one is actually reference, non-metformin group is reference group. Then we have retrospectively we followed. We followed them, and this is actually our study title. We have done a study and published in a Brazilian Journal of Infectious Disease. This is actually the PharmD project. It's a protective effect of metformin against the tuberculosis infection in the diabetes patient. Okay, so an observation study of South Indian tertiary care health facility. So what we have seen that we have calculated finally relative risk and even the odds ratio. We found that the patients with the metformin group have 3 times protective effect. We have calculated the odds ratio, and one odds ratio will be saying the risk. Okay, but since we are looking for the protective effect, 1 by odds ratio we have calculated. We found that the metformin group have 3 times protective effect against the tuberculosis compared to non-metformin group. Okay, that's what our findings. Even the number need to treat to harm also we have calculated. So that's what the one classical example, how the literature we have derived the topic for the research question, and finally done the research. So second one, the same way, the example for the research from the literature search, how we have derived the research question. So for example, the same way 2014, we have happened to read one article in the BMJ. So the title was, that article was higher potency statin and the risk of new onset diabetes. So it was a multi-centric observation study of administrative database. So you can see that until that our belief was actually the people who are the diabetes, statin, the diabetes and a high risk for cardiovascular disorders. Okay, those who does not have the cardiovascular risk, but they have the diabetes and some family history or high risk obesity or hypertension. All these people should receive the statin. Right, because you can see that statin have the primary prevention and secondary prevention against the cardiovascular diseases, because statin have the one effect called pleiotropic effect. A pleiotropic effect is nothing but, you can see that the anti-inflammatory, apart from the lipid lowering action of the drug, it has a anti-inflammatory drug, endothelial protection effect, antioxidant effect. Okay, all this togetherly called the pleiotropic effect of the statin. Okay, because of this pleiotropic effect of the statin, it can be used for the primary prevention and even secondary prevention of the cardiovascular risk patients. So that's what. Until that, we have believed that the statin should be given for the diabetes patient who have the multiple comorbidity or risk factor for developing the cardiovascular disorder. But this study have came up with it's a multi-centric data. It is conducted throughout the Europe and even the Canada. They came a conclusion that higher potency statin have the high risk of getting a new onset of diabetes. So then we think that, okay, they have mentioned about the higher potency statin and risk of new onset of diabetes. So that they have conducted mainly in the Caucasians, Europeans actually. But when you look into when we are read the literature, we found that there are a lot of studies from for example, you can say Mohan Diabetes Clinic in Chennai, or they have a lot of publications they have done on this area. Okay, they have found that Indians, especially South Asians population, have the multiple risk factor already they have for the developing the diabetes. Okay, we already have the multiple risk factor because we have a particular phenotype. Okay, you can see most of our population. Okay, normally when we type 2 diabetes, people are usually obese in the Western concept, but even in India, you can see lean people are obese, and with low BMI, people are getting the diabetes. Okay, lean people are getting the diabetes. The low BMI people are getting the diabetes. You can see that the threshold for getting the diabetes is very low. That means easily the South Asians will get the diabetes. So with such kind of phenotype we have. So that's the reason. So we thought that, okay, why can't we do a study and find out whether the people with the high potency statin or whether any potency statin, whether low or medium potency statin can also cause the diabetes in our population or not. So there was a journal called Medical Hypothesis. Yeah, you can see here. We have come up with an hypothesis that the South Asian population have a higher likelihood for the diabetes risk for the statin, regardless of the potency. Okay, it may not be a high potency statin, even the lower potency statin like pavastatin, pitavastatin. These are some of the lower potency statin. So that can cause the diabetes, new onset diabetes in our population, because we already have the multiple risk factor for getting the diabetes. So this we have published in the Medical Hypothesis. So if you have any good idea, okay, even though if you have not done the study, but if you have very good idea, if you have very supporting evidences, okay, convincing way if you have written, so you can publish this the hypothesis in this journal, Medical Hypothesis. It's a very well-known, reputed journal, because a lot of people are actually looking into this journal and getting the idea and doing the research. So that's what we have published this article. This also, so you can see that
Hello.
Hello, sir. Hello.
Hello, hello? Can you guys can hear now?
Yes, sir. We can hear you.
Yeah, sorry for the interruption. Between the internet connection is lost. So the previous slide. Hello.
Yes, sir.
Yeah. So I think you are lost from here, right? This is the slide, right? Hello.
Yes, sir.
Yeah. So I will just repeat about the standardized patient. So it is one of the method if you want to conduct the studies in the community. So as I mentioned earlier, the standardized patient is nothing recruit and we will train them portray some kind of clinical scenario. So we have to teach them we have to develop some clinical scenario, teach them. So this concept of the standardized patient, it was introduced in the medical curriculum in 1960s. So what is the benefit of this? You can see that as this name implies, okay, standardized patient offer a standard and control experience for the learners. So the beauty of this method, the sections, what are the sections we are performing with standardized patient? It is actually measurable and even the reproducible. Okay, you can see that unlike the peer role play or the use of test, so the educational purpose which has and even SP training. But in these cases, the standardized patient will act rigorous training to maintain consistency, consistent, and even the realistic kind of approach. So not only that, end of this section, SPs can give a feedback also, and even they can score how you are performing also. That there is some score if you are giving some scoring checklist to the SP. That training, so they instead of directly, but that is for the educational purpose. You can see that how this can be used for the community-based studies. So there are already, you can see that, okay, the studies have pharmaceutical care aspects are actually working or not. So we can see that some of the studies were used in our Indian setting itself. You can see SPs has been used to assess quality of care in India and even the other low and middle income countries. For example, so SP studies have in India shown that private retail pharmacies are the source of non-prescription antibiotic or the counter antibiotic prescription. So I will show some of the example. Even we have done one studies on SP based for the antibiotic or the counter antibiotic display. Where the prescription audits are you. So that such cases we can use this SP studies methodologies at the pharmacy, in the pharmacy how they are practicing, whether the ethical way they are practicing or not. For that we can do SP studies. So this SP studies is, we can say that it is a gold standard method to assess the provider practice. So in the pharmacy use the provider healthcare provider for SP studies and see that to check the provider practice, whether it's ethical way or whether it's they are following rational way, they are prescribing the drug, or whether they are dispensing the drug at the pharmacy in the rational way. All these things we can check by using the SP studies methodology. Already I told that there are some studies I have done already. You can see some studies. This methodology has been successfully applied to provide insight on how the pharmacist can manage TB or respiratory tract infection for the adult patients as well as pediatric diarrhea cases. Okay, that you can see that actually through the SP studies, they have seen that 15 to 40% of you can see SP studies involve actually non-prescription antibiotic. The previous studies, what they found that through the SP studies, 15 to 40% of antibiotic dispensing or over-the-counter antibiotic dispensing. That was through one of the SP study. So based upon the previous studies, we also try to replicate the same studies in our setting. Okay, so we have done we have quantified over-the-counter antibiotic dispensing by the pharmacist, okay, in our district, Udupi district in India. So it was published in the 2015, okay, 16 BMJ article, BMJ Global Health Journal. So in that, what was a little, I will talk about how we have performed that study and what was the key finding of that study in that SP study. So the primary objective of our study was actually to assess overall non-prescription OTC antibiotic by the private community retail pharmacies, okay, for the adult and even the children, okay, upper respiratory tract infection. We have created 3 scenarios, SP scenarios. One is for the upper respiratory tract infection, then acute uncomplicated diarrhea. Third one was a fever suggestive of malaria. These are the 3 scenarios. For each 3 scenario, again we have done for the pediatric scenario and even the adult scenario. Okay, secondary objective was actually to examine how this outcome, okay, differ between the adult and children, and to determine which factors of SP visit, okay, were associated with antibiotic dispensing. So what factors we have considered here? You can see that history taken by the pharmacy, client volume at the time of SP visit at the pharmacy, and whether the SP was referred to another provider, or the approximate time spent by the pharmacy at the pharmacy, and pharmacy location, whether it's urban pharmacy or rural pharmacy. These are some of the factors, okay, considered for the SP visit, okay, during the antibiotic over-the-counter antibiotic dispensing. So as I mentioned earlier, you can see that we have created the 3 scenarios. First one is, you can see first column, you can see the case scenarios: upper respiratory tract infection. Second one is uncomplicated acute diarrhea, and finally acute febrile illness. So second column, you can see that the symptoms, okay, what is in that case scenario, what are the symptoms for upper respiratory tract infection? So we have once the case scenario, we develop individual with a 2-day history of acute onset low grade fever with runny nose and non-productive cough, okay, does not look sick. The family members have the similar symptom. That was the case scenario. And when the SPs visited the pharmacy, third column, it's an opening statement by the SP when they are entering to the pharmacy, when they are interacting with the pharmacist. So they will tell that, okay, already I mentioned that each scenario we have further divided into the child and even the adult scenario. In child with upper respiratory tract, what was the opening statement? You can see, sir or madam, that based upon the gender of the pharmacist, my niece at the home has fever and cough. Can you give me some medicine? Same adult scenario, you can see upper respiratory tract infection. Since 2 days I have cough and fever, can you help me? Okay, that the SPs will present in front of the pharmacist. So we have to see that what are the expected management and what are the unaccepted. Okay, accepted and unaccepted management we have to see. Accepted one is, in this, you can see not dispensing antibiotic with or without referral to a doctor. Okay, dispensing symptomatic treatment according to the current guidelines is acceptable. But unaccepted one is dispensing antibiotic or steroid or both. Okay, that is unaccepted response. Okay, after the interaction with the SP with the pharmacist. Similar way, you can see uncomplicated acute diarrhea. We can see that the symptoms, what we have, the case we have derived is individual with 1 day history of acute onset watery diarrhea, no blood in the stool and no fever, and appears well hydrated. What was the opening remark by the pharmacist at the pharmacy? You can see the child cases with diarrhea. Sir or madam, my niece at home has diarrhea. Can you give me some medicine for her? Okay, for adult scenario, I have diarrhea. Can you help me? So what is the acceptable response? You can see here the dispensing oral rehydration salt. That is ORS. Giving ORS is fine, acceptable one. Okay, not dispensing antibiotic with or without referral. So not giving the antibiotic also acceptable. For child cases, you can see ORS with zinc. Unaccepted response by pharmacist is dispensing antibiotic and restricted anti-mobility. Loperamide, for example, it is actually scheduled drug. So that should not be given. Okay, that is unacceptable one. Last case was actually acute febrile illness suggestive of malaria. Okay, so here you can see the individual with 4-day history of high-grade fever with shivering and chill every other day, alternative day, no cough or any other symptoms, no headache or fits or altered consciousness. So child with fever, you can see scenario, sir or madam, since 4 days my niece has fever and chill, can you give me some medication? Whereas adult scenario, you can see here, I have fever since few days, that is not going away. So that way, we have created a scenario. Here accepted one is referral to the malarial blood test without dispensing anti-malarial or any antibiotic. Whereas unacceptable and dispensing antibiotic or steroid. Okay, this way we have created the scenario, and SPs visited the pharmacies for the 3 cases. Okay, each time they will present only one scenario, not like 3 times. When they are visiting, one SP will tell all these things. We are recruited 3 SPs. Each SPs will present one scenario at a time at the pharmacy. Then they will ask for the medicine. If any antibiotic or any drugs are dispensed by the pharmacist, then SPs will come and buy. They will buy and come back this medicine, and we will sort it out what classes of medication, everything. Because this was actually funded project by the McGill University, Canada. So we have a fund for buying the medicine. Okay, and we will come and sort it out. We came and sort it out. Okay, which category, whether it's what therapeutic category, whether it's a schedule H1 or schedule H. That way we have categorized all these medicines dispensed by pharmacist. So you can see here what are the key findings of that study. So we found that very low incidence of dispensing. Just 4% of pharmacies have provided the over-the-counter antibiotics. So you can see that in the Udupi district, we have completed 1,522 pharmacy SP interaction, including the 3 conditions in both cases, adult as well as children's, for 3 scenario: upper respiratory tract infection, diarrhea, as well as fever. So our key finding is only 4% of pharmacies provided non-prescription antibiotic. But you can see, even though low rate of over-the-counter antibiotics prescription, but the case management by pharmacy, like referral to the clinicians, or even you can see that suggesting the counseling the patient, or that means case handling by the pharmacies was still poor as evaluated by the adherence to the international guidelines. This was our key finding. So it was very surprising that only 4% of pharmacies have given the over-the-counter antibiotic dispensing. So this study we have done pre-COVID area. But during the COVID, we have seen that there was a lot of literature and newspaper. We have seen that there are a lot of articles published that during the COVID time, the antibiotic sales are increased, especially for the azithromycin. Sales have drastically increased during the COVID period. So during the COVID period, we thought that, 2021-22, we thought that why can't we do one study with azithromycin? So in that cases, our scenario was little different. We are not developed any clinical scenario. Instead of that, we the SPs directly went to the pharmacies and asked the medicine directly. Previous study, we are not asking any kind of medicine with its name. Instead of we have created the clinical scenario and asked the pharmacist. But this case, second study, what we have done, the SPs will go to the pharmacy and they will ask the azithromycin, like one of the common brand, ASI 500. The SP will directly ask the ASI 500, not complete dose, just half dose, that 1 or 2 tablets they will ask, whether how the pharmacists are responding. But that result was very, very surprising and contradictory to our previous finding. We saw that 99% of pharmacies have actually dispensed azithromycin ASI when we are directly asking them the name of the medicine. Okay, only 1% of pharmacy, because that pharmacy does not have azithromycin any kind of brand. Otherwise, they also will be a dispense. That was very surprising, and there is a very high need of you can see community-based antimicrobial stewardship program implementation. So that's what the study about the SP study. There are other studies throughout the India. Okay, other people have done the various studies. I have just given some of the examples of the studies published in the well-known journal like PLOS One. Okay, you can see PLOS Medicine. It is published about the variation in the quality of tuberculosis care in the urban India. It was a cross-sectional standardized patient study in 2 cities. They have studied in the Pune as well as in the Mumbai cities. Another study was, you can see that it was published in the Lancet. You can see the use of standardized patient to assess the gender differences in the quality of the tuberculosis care in the urban India. Okay, the same way they have done the Kolkata as well as Pune, they have done this study. So this is about the various SP studies. Now we will move after conducting your research. Okay, how to disseminate your research findings. So it is very important to, okay, if you've done the study, if you are not publishing, then there your time, money, okay, your effort, everything is going to be vain. Okay, you are not going to get anything out of that. So immediately you have to prepare the manuscript. Okay, don't keep for a while. So immediately you have to, once you've done the study, start writing your manuscript. Okay. Meanwhile, ready your manuscript, and if any international conference or national conferences, you can present this in the national or international conferences. Especially the PharmD students and MPharm students, those who are looking for a job or even the higher studies. One of the things the recruiters or even the institution where you are applying, if it is a reputed institution, they will always go through your CV and they will see whether you have your undergraduate or postgraduate level, whether you have made any kind of publication and what area kind of research you have done. So that's what you have to publish the very good journal. Okay, either you have to look into the impact factor of the journal, or there are another metrics called quartile. Okay, there are different journals are classified based upon the quartile. Scopus, they are giving like various called Q1, Q2, Q3, and Q4. The Q1, Q2 are the top journals. Okay, after that Q3, and finally Q4. So based upon that, journals are actually classified based upon the Scopus data, or based upon the impact factor. You can choose the journal. Okay, whenever you are choosing the journal, the scope of the journal you have to see, because whether your study is actually matching with the scope of the journal or not. Otherwise, simply if you are not looking to the scope of the journal and sending to some randomly or selecting a journal and sending, there is a high chance it will get rejected, saying that it's not under the scope of the journal, and you are losing the time. Okay, meanwhile somebody else have done the same study and they will publish. So that's the reason. Okay, you have to be very careful. Okay, as soon as your research is done, try to make the manuscript and publish. So another things what you can do is to disseminate your research finding. You can publish you can present your findings in the various conferences as an abstract. So I will tell you some of the international societies. Okay, whenever you are going for the conference, see that it's a very good conference and it is organized by some reputed international organizations or societies. Coming slides, you can see some of the well-known organizers also. So these are the publications done by my own students, the PharmD students and MPharm students. You can see. So this was published in the 2019. This study is published in one of the top journal called Antibiotics: Adverse Effect of Fluoroquinolone, a retrospective cohort study in a South Indian healthcare facility. Recently, the last year pass out student, you can see that here his article was actually published online. Okay, still it is not, final volume is not come, so it is online, it is available. So the predictors and pattern of empirical antibiotic therapy and associated outcome in the COVID. You can see this is a retrospective cohort study we have conducted. The benefit of this some way we are publishing the journal. It's a very reputed journal. 5 and even the Q1 quartile journal. So the first author you can see, Lipin Lucas, presently is in the US. John Hopkins University is doing the higher study in the area of public health, global health. So that's what if you are seeking for the good institutions abroad, okay, they will value your publication in the undergraduate or postgraduate level. So similar way, the findings of the articles, your findings of your research can be presented in the various conferences. So I will just present you some of the societies conferences. One of the very common society aligned with our field is actually International Society of Pharmacoepidemiology. Every year they have the three major conferences they will conduct. One is actually international conference at the global level. Okay, coming conference, international conference, ISP is called ICP. So ICP is society name is ISP. The conference name is ICP, International Conference. So coming conference is in the Berlin, okay, August 2024-28 in the Berlin in the 2024. Apart from that, they have the mid-year meeting. Usually it will be happening in the April. Apart from they have the Asia Conference or ACP. Okay, last year it was ACP of ISPs. It was happening in the Bangalore. The JSS actually hosted that conferences. So beauty of why I was insisting about this conference, this society and conferences, because if you are applying if you are submitting the abstract and if you are applying for the scholarship, okay, sometimes they will give the full scholarship to. Okay, most of our students every year, I can say probably that almost 5 to 8 students every year in our department are getting this scholarship. They're getting complete waiver of the travel and even registration, and even you can see that the accommodation. Okay, everything will be taken care by this ISP. So anybody is interested, please go and see that Asia conferences. Okay, it is, I think the coming Asia conference is in the Japan. So the abstract submission is already open. Okay, you can go and upload your abstract and even apply for the scholarship. If you are lucky enough, you will get the full scholarship. Sometimes they will give the partial scholarship. It will cover only registration. But they will give a very large number of, especially Asia conference, Asian have a very good preference. So you have a chance for getting the full scholarship to at Asian conferences. Another society, I think most of you know this one, International Society for International Society for Pharmacoeconomics and Outcome Research. So who are doing the research on the health outcome and even health economics and outcome research, that is called HEOR. So such area who are interested, you can go and become a member in this ISPER. So ISPER also have the annual conferences. So if you are interested, you can present it, but scholarship is very limited compared to ISP. Then another society, International Society for Infectious Disease, ISID. So those are working mainly in the area of infectious disease. Okay, they can register this free registration. You can freely become the member in this society. Apart from that, they have the grant mechanism also. Every year, March, April, they will call for the ISID small grant program, especially faculty. This is for the faculty I am talking. So they can apply for the ISID small program. If they will fund around March, April, usually you can see that the application will open normally. Another society, FIP, International Pharmaceutical Federation. So they also have the World Congress every year they will conduct. So this year it was in the you can say that South Africa, Cape Town, okay, the World Congress of FIP. Another society, you can see Society for Infectious Disease Pharmacist. So especially PharmD and MPharm clinical pharmacy students, so they are offering various fellowship. Okay, you can even the clinical pharmacists, those who are working the full-time clinical pharmacist also, they can join for the various fellowship in the area of infectious disease pharmacist. And those are interested for the drug safety and pharmacovigilance, a society called ISOP, International Society of Pharmacovigilance. So they will also have the various annual conferences they are conducting globally. So if you are interested, but the scholarship is very limited. Okay, highest scholarship is offering by ISP. So even you can see that for the students exchange, for example, PharmD students, anyhow they have the 6th year, they can go and do the internship anywhere, even within the India also, even abroad also. 3 months they can do the internship. Some of our students, we have a lot of tie-up with the various foreign universities, especially Australia. So you can see that they have the Australian government is offering various scholarship for the students to go to the Australia. Asian students can go to the Australia and they can do this internship abroad in the Australian university. Similar way, Australian university students can come to the India and do the internship, short-term studies or internship in India. So that program is called Chenkong exchange program. That is called the 4 of our students are in the Australia, Sydney University. They went through this program and they are doing the internship, 3 months internship in the Sydney University. So this is actually the scholarship of Australian program or Destination Australia Chenkong exchange program. So the purpose of this program you can see here. Okay, this program support the Australian universities to offer short-term mobility scholarship opportunity for outbound Australian students. Those are willing to go, Australian students, those are willing to go outside. Similar way, inbound Asian students. So Indian students are coming under inbound Asian students. So we can go to there and do the internship, short-term internship. So those are willing to do India itself. You can see that other opportunities also. There are various state governments also offering the various funding mechanism for the students. For example, Karnataka, we have the Karnataka State Council for the Science and Technology. There are the students project, there will be funding. So PharmD or MPharm students, every year they will call for the application. So you can submit your project. Similar way, I think Kerala State also, they have the Kerala State Council for Science, Technology and Environment. Similar way, I think your state also have the state government funding for the students. So you can apply for that. This is some of these are throughout the year it is open. Even you can see ICMR also. I have forgot to mention that ICMR also have the students project. They have the internship program, bioinformatics and data science. Okay, there's last year few of our students actually went to the ICMR institutes. Some are in the Chennai and even some went to Pondicherry and even Bangalore. They have different state. They have actually the ICMR offices. They are providing the internship with the paid internship. Actually, students will get around 10,000. That way around they will get the stipend for the bioinformatics and other related area and even data science, health system analytics, all area. The PharmD students can easily do the internship program at the ICMR institutes. So finally, we look into what are the challenges. So broad way, if you say the challenges are, we can say that role related sometimes the settings related, sometimes theme related. Okay, for example, role related, you can see that the supervisor challenges is totally different from you can see the students, like you can see the data collector or who are involved. The supervisors, you can see that the coordinating that entire team or the getting the grant, the faculty level, the challenge is totally different. So most of the faculty researchers are actually, we need the grant to perform the research. But the students project grant may not be required, like undergraduate or postgraduate I'm talking, grant may not, but PhD, most of the PhD work we need the grant, but undergraduate and postgraduate level without grant also we can do the small studies. But students challenges is totally different. For example, the writing the protocol in the correct time, getting the patient, okay, the feasibility of the topic, a time frame, because you are getting very short period. For example, Form D, you will get the applying for IEC, getting the approval of the IEC, all will take time. Eventually, you are getting only 3 to 4 months to complete and start and complete your project. A time frame is very important. So the planning, that's the reason what we have doing in here. At the end of the 4th year itself, we will allot the students among the faculty. The supervisors will be allotted at the 4th year itself. After their university exam, students will start preparing their protocol, and they will, if possible, they will submit to our IEC. Okay, normally our IEC will take to 1 to 2 months, depends upon the volume of application. 1 to 2 months they will take to clear the protocol. Okay, so students will submit before going for the vacation. Once they come back, okay, they may get the approval. So they are not losing any time, because if you are starting everything in the 5th year only, so the problem, okay, we have to get the approval, we have to present the department committee first, then institutional ethical committee, and getting the clearance from that. Once IEC, most of our project IEC will recommend the CTRI register, Clinical Trial Registry of India. Okay, we have to, some studies, they will recommend that. Again, we are losing another month. So that's the reason we will allow the guides in the 4th year, and even the topic students will start working in the 4th year itself. End of the 4th year, just after their exam, they will submit the protocol and they will go for the vacation. Okay, once they come back for the 5th year, they can immediately start their study. That's a way we are actually trying the most of the challenges facing by the students. Some extent we have tried to solve, but still there are other challenges also. Then you can see that the settings related, you can see that if you does not have your own hospital, so the number of files getting per day, it will be limited. Or the retrospective, if you don't have very good databases, okay, if electronic databases, if you have, you can do the retrospective studies will be done within a very good way. We can collect the data, authenticated data we will get, okay, unbiased data we will get. All the information will be available. If instead of going and searching into the hard file, we can even easily we can access the electronic file. But every hospital or government setting, that may not be feasible. So still some of the hospital are following like hard files. So each and every file, if you want to go and dig, if you want to get the information. Then you can see team related. Okay, the team, some people will be working very ethical way, and even sometimes they will be hardworking. If team members, especially in case of Form D program, MFORM there is a single project, but Form D you can see since it's a group project. So that what one team, if we are not getting the balanced team, everything will be in the misplaced. Okay, the writing the protocol, conducting the research, writing the research, and finally publication, all will be actually, they will be affected if you does not have a very good team, understandable team. So how we can solve? Sometimes there will be a dispute among the students. There are equally work students. Okay, who will be the first author? Who will be the corresponding? So corresponding author in our case, it will be always the supervisor. But first author and subsequent authors will be students in the group. So if there is a students, if you have given the group project, there is a 2 students are there in the group. Both are equally worked. So who will be the first author? That will be a challenge. So there is a solution that now the most of the journals are coming up like equal contribution. So we can first and second author, we can put some mark, asterisk or something, then down we can write equally contribute. So that will give the weightage for both first and second author as a equal contribution. They will get the equal weightage. That's some way we can solve that problem. So not only that, you can see that challenges are n number. So I have just listed out few, but based upon your settings, based upon your institution, you can see that there will be a further challenges. It's always continuing. So how we are solving, that is the most important. No project does not have any without any kind of challenge. So this is what the topic about my presentation. So I want to end my presentation with one of the famous quote by Zig Ziglar. He is a motivational speaker. If you are not willing to learn, no one can help you. But if you are determined to learn, no one can stop you. So that's all. So if you have any kind of questions, you can ask to me. Any questions?
I think it was clear enough that nobody has any questions, sir.
Okay.
Thank you very much, sir, for accepting our invitation.
Yeah.
I hope I
Thank you, ma'am. Yeah, thank you. So I can share the slides. Somebody want, you can, I will send you, or even if you have any further questions, even you can mail me in this email ID.
Sure, sir. Sure.
Thank you.
Just a minute, sir. Thank you so very much, sir, again for accepting our invitation and for giving this valuable information. Your information has enlightened our participants in the field of research and pharmacy practice. Your insights on the topic were very useful and informative. Again, thanks a lot. We are glad to have you here, sir.
Thank you so much, ma'am. Once
I
again,
request
thanks
all
for
the participants to kindly fill the feedback form. Thank you so much, sir.
Yeah, thank you.
The feedback link has been posted in the chat. I request all the participants to fill the feedback form before dropping out of the session.